Vanakkam, let me introduce myself. I am Dr. Chandrasekhar. I am a senior cardiothoracic surgeon working at Sri Gokulam Specialty Hospital, Salem, Tamil Nadu. Today's topic is congenital heart disease. So, what is congenital heart disease? Is defects in the heart which are present already when the baby is born. So, these defects are there even in the womb of the mother, and they manifest once the baby is born. So, what are the commonest types of congenital heart disease we see? Ventricular septal defect. That means there is a hole in the heart between the two pumping chambers of the heart. This is the commonest congenital heart defect. The second one is atrial septal defect, where there is a hole between the upper two chambers, left and right atrium. Then we have a patent ductus arteriosus. This is a connection between the aorta and the pulmonary artery, which is essential for the child's for the fetal circulation when the child is in the mother's womb. It usually closes soon after birth because when the child starts breathing, it takes oxygen. The muscles that are there in this patent duct are very sensitive to oxygen. So, as soon as the child is born, within few days, maybe within a month, this patent ductus closes by itself and becomes what is called as ligamentum arteriosum. But in some unfortunate babies and children, this does not close and it remains open. As it remains open, it is patent. So, hence it is called patent ductus arteriosus. Because it is patent, the blood is flowing from the aorta back into the lungs, and so that it causes flooding of the lungs. So, if it is very large, even small babies will have what is called as congestive heart failure and failure to thrive. So, sometimes, especially in preterm babies, it becomes almost like an emergency to even go and operate or ligate this patent ductus even in a NICU. If the child survives this period, little later surgery can be done at any age, and surgery is an indication if there is a patent ductus arteriosus to prevent further complications like pulmonary artery hypertension, infective endocarditis, and so on and so forth. Now, let us come to atrial septal defect. In atrial septal defect, also there is a left to right shunt. More blood is going into the lungs from the left chamber, upper chamber, to the right upper chamber, into the right ventricle, and then the pulmonary artery into the lungs. So, again the same situation arises here. The children may develop pulmonary artery hypertension, and they develop dilatation of the right ventricle, the right atrium, the pulmonary artery. So, the ideal age to operate on these babies, children, is preschool. Of course, now there are other modalities of treatment that have come, like device closures, which can be done for patent ductus arteriosus, device closures for atrial septal defect, but certain types of defects we cannot do a device closure, hence surgery is a must. The third category is ventricular septal defect, where the blood from the left chamber, left pump is going into the right side, right pump, and from there back into the pulmonary artery, into the lungs. They have a similar situation, and failure to thrive, the baby is not suckling, and frequent infections of the lungs, which is known as respiratory tract or lower respiratory tract or upper respiratory tract infections, and failure to gain weight. So these babies need to be operated as early as possible, as early as 6 months of age. Then we go to other aspects of congenital heart disease, where we call it as blue baby or blue children. The child is blue in the toes, in the tongue, because the blood is not properly oxygenated. Blood is not reaching the lungs where it needs to be oxygenated, and becomes pure and comes back to the left side of the heart. Because of some defect in the right ventricle and the pulmonary artery, and then the pulmonary arterial valve, which is stenosed or atretic, these babies, unfortunate babies, have blue discoloration, and they are known as cyanotic congenital heart disease children. So if they are seen early, maybe 6 months, 1 year age, they need to be operated. But if they are having very severe condition, they are having what is called as cyanotic spells, where the child will even can have convulsions because of very low oxygen in the blood, they need to be done on an emergency basis. We usually do what is known as Blalock-Taussig shunt. So there are so many other cyanotic congenital heart defects, but tetralogy of Fallot, which I have been describing all along, is the most common cyanotic congenital heart disease we see. What are the other procedures, other surgical procedures for cyanotic congenital heart disease? We can perform bidirectional Glenn operation, where the superior vena cava, which brings deoxygenated blood, the impure blood from the head and neck, is directed into the right pulmonary artery, so that directly it goes and gets oxygenated and comes back to the left side of the heart. So for today, I think congenital heart defect we have covered enough, and in the next session we will go into rheumatic heart disease, about heart valve repairs, heart valve replacements, etc. And thank you very much.